We're right now in the process of renegotiating the subsidy that has been given to two facilities to provide hemodialysis. We believe that the agreements we had in the past no longer hold. I think we believe as the Minister of Health that we can get a lot more people on the dialysis program with the same amount of money that we have. So we're in the process of negotiating that with both facilities. We are considering probably extending, maybe contracting, and this will be done on a contractual basis. Right now it's a straightforward subsidy transfer from the government to these facilities. We want to establish clear contracts and guidelines so that we know exactly what we're getting for the money that we're paying them, and increasing the number of patients on the listing for those two facilities. So that's where we are. In addition to that, we want to see if we can extend contracts, probably utilizing one or two of the private providers that are providing hemodialysis services. Of course, we have to do an assessment to ensure that they meet the standards that we are expecting. And the reason we want to do this is because, remember, people are from all over the country. And even though we've improved access, because people no longer have to go to Merida or abroad to get hemodialysis, at the end of the day, if people have to travel from PG to go all the way up to Belize City to get hemodialysis, it's still an inconvenience. So we're trying to see if we can get maybe somebody that can provide services up north, so people from up north don't have to travel all the way to Belize City. It's more an access issue. So that's another phase of the negotiations, to see if we can get additional providers to provide hemodialysis services.
Okay. Would there be tendering for bids or anything like that?
We would want that to happen. But again, you would tender based on whether they meet the standards and the criteria. So we have our teams doing an assessment of the facilities out there to ensure that they meet the standards. Once you meet the standards, you're eligible to be given a contract.
Are we looking at perhaps facilities that are outside of Belize presently, perhaps whether it's Mexico, neighboring Guatemala?
Not at all. No. We have the providers in country. All right. You mentioned somebody who came from Honduras, set up a company here in Belize. They have a long trajectory and experience of providing hemodialysis services in Honduras. We did our background checks even before this is. I mean, they've been here for quite a number of years, and we've been following the results. Initially, we had a little bit of trepidation in terms of ensuring or granting them a permit to provide the services because we weren't sure. This is something new. But as I said, we did our background checks in Honduras. They're a legit company, a legit group. So I mean, at this point in time, the results that we have seen from that company are good. So we just need to ensure that internally they have all the parameters and standards that we expect them to have. And so they will become a legitimate company. And a lot of Belizeans are getting services from them.